This is adult assessment, so I have all my supplies right here. I have my blank piece of paper and my pencil. My vital signs. Knock knock.
Hello.
Hi, I'm Amanda. I'm going to be your nursing student for today. Can you please tell me your name and your date of birth?
My vendor, 11/13/60.
Okay, are you allergic to anything?
No, I'm not.
Okay. So I'm gonna do a head-to-toe assessment on you. The reason why we're doing a head-to-toe is to detect any medical abnormalities that may need further medical attention. A head-to-toe assessment is basically where I look, listen, and feel to all of your parts of your body. So if you're uncomfortable, or if you're experiencing pain or tenderness while I palpate, or the other word is touch, you please let me know.
I will.
Okay. So can you tell me about any spiritual or cultural beliefs that you may have that
No.
might impact the care? Okay. Do you have like a support system?
Yes, I do.
Okay. Can you tell me about your relationships?
I have lots of them. Oh, okay.
Okay. How have you been feeling emotionally recently?
Very good.
Okay. So now I'm going to do a set of vitals on you. And grab your blood pressure. I got 120/74. Blood pressure of 120/74. I'm going to grab an oxygen, a pain, a temperature, a respiratory rate, and a pulse. So I'm going to put this on your finger and measures your oxygen and your pulse, and I'm going to take your temperature on your forehead. Okay, 98.6. So your respirations were 12, your oxygen was 92, and your pulse was 70. Can you rate your pain on a scale of 0 to 10, 0 being no pain, 10 being the most?
0.
0? Okay. So, I'm just going to ask you some silly questions so that these help me assess your medication, okay?
Hmm?
So, can you tell me who you are?
Roy Painter.
Can you tell me where you are?
At the hospital.
Can you tell me what time it is?
Around 2:30.
Alright, what's the event going on? Like, what's the situation you're in?
I'm having a mental assessment done.
Okay, so based on our interactions, I can say that he is conscious, he is alert-oriented to a person, place, time, and event. He is able to willingly follow my commands because he answers my questions appropriately. His mood is relaxed, and the effect of that is having a relaxed body language. He is very calm. His speech is fluent, a monotone, and his auditory acuity, he's able to hear me talking at a moderate pitch. In my general impression, he is wearing clothes that are appropriate for the weather. He's positioned at a semi-Fowler's position on the bed. He doesn't have any poor odors coming from his breath or his body, and he's not in any immediate distress. So now I'm going to inspect your head. So I'm inspecting the head for size, shape, and symmetry. So it appears to be normocephalic. The shape is proportional to his body, and his head is symmetrical. He does not have any deformities. Okay, you lift up your head. There are no masses present. His hair is even in distribution with no infestations. Okay, I'm gonna palpate your sinuses. Okay, are those tender or swollen?
Yes.
Okay, so his overall appearance, he appears relaxed and well groomed. He relaxed and well groomed. I'm going to now assess your facial movements. So can you smile real big? Frown? Okay. So he had full range of motion on his facial movements. He doesn't have any deficits and his face is symmetrical. So now I'm going to assess your eyes. So I'm looking at your eyes. I see that your eyelids are not swollen, your conjunctival sac is pink, your sclera is white, and you don't have any nystagmus or strabismus present. And now I'm going to assess your pupils. Okay. Can you focus on my pen right here? I'm going to focus on something behind. So his pupils are equal round, reactive to light, and in combinations. And now I'm going to assess his nose. So his nose is symmetrical. There's no signs of skin breakdown. His skin is clean, dry, and intact on his nose. There's no mucus coming from his nose. Are you able to breathe through your nose effectively?
Yes.
Okay. So now I am going to assess your ears. So I have this gauze. I'm going to assess for drainage. I'm not going to stick the gauze in your ear all the way, just a small portion of the way in, just to assess for drainage. So can you turn that way? So look at his skin integrity. There's no lesions present. His skin is clean, dry, and intact, and the color is appropriate for his ethnicity. I'm going to assess for tenderness. Are you tender?
No.
Okay, so now I am going to assess for drainage. There's no drainage present. Okay, can you turn the other way? So his skin integrity is clean, dry, and intact. There are no lesions, and the color is appropriate for his ethnicity. I'm going to palpate for tenderness. Are you tender?
No.
Okay, I'm going to put this in the ear. There's no drainage present. So now I'm going to assess your mouth. So your lips are pink and moisturized, and now if you can open your mouth and keep that open. So your uvula is midline, your mouth color is pink, your dentition, you don't have any chipped teeth, and there's no odor coming from your mouth. Your mouth is moisturized, your uvula is present, there's no lesions. Do you wear dentures at all?
No.
Okay. So yeah. So now I'm going to assess your neck. So I'm looking at the neck. Your trachea is midline and there's no DVT. I don't see any swollen lymph nodes, Gaudier, or masses. Now I'm going to palpate your carotid. So can you turn that way? Carotid is present, 2+, there's no JVD. Alright, other way please. Carotid is present, 2+, no JVD. Now I'm going to palpate your lymph nodes. Are those tender?
No.
Non-tender lymph nodes, and they are non-swollen. Have you had any difficulty with swallowing?
No.
Have you had like any changes on your vision, changes in sense of smell? Do you have any concerns regarding like your mouth and swallowing and your hearing? No. Okay. So now I'm going to assess the arms. So I'm going to look at the arms. So his skin is clean, dry, and intact with no deformities. His skin color is appropriate for ethnicity. There is no swelling. So the skin color is clean, dry, and intact and appropriate for ethnicity, and there are no deformities. So I'm going to look at his knuckles. His knuckles are not swollen and his fingernail shape is not clubbed. His knuckles are not swollen and his fingernail shape is not clubbed. So now I'm going to assess circulation. His skin temperature is warm on both of his arms and his bilateral pulses are equal and 2 plus. Now I'm going to assess the capillary refill. Okay, less than 2 seconds on his left hand for all of his nails. Okay, capillary refill, less than 2 seconds on all of his fingernails on that one. He is warm to the touch. Alright, now I'm going to do your motor skills. So can you squeeze my hands? Equal grip strength. Now can you go like this? He has full range of motion. Fine motor skills. Now I'm going to have you sit up and do big motor skills. Lift up like this, lift down like that, and do circles. Okay, so he has full range of motion on his gross motor skills as well. Now I'm going to look at his muscles. His muscles are equal and symmetrical in size bilaterally. Now I'm going to do the sensory. So I'm going to have you close your eyes and I'm going to touch one of your fingers and then you let me know which one I'm touching. Okay.
Pinkies.
Okay. That's good. Now I'm going to palpate. Let me know if you're tender. Are you tender?
No.
Okay. No masses or deformities present. Are you tender?
No.
Okay. No masses or deformities present. You are not swollen. So now I'm going to have you hold my hands. Okay. Now squeeze. Okay, equal grip strength. So now I am going to inspect your back. So I'm looking at his back, looking at his skin integrity. His skin is clean, dry, and intact, and the color is appropriate for his ethnicity. His spine is within midline. I do not know any surgical scars or kyphosis. Palpate for tenderness. Are you tender?
No.
No tenderness or masses present based on palpation. So now I'm going to inspect your chest. You can go ahead and lay back down. So I'm looking at his chest. He has equal and symmetrical chest rise and fall. He's not in immediate distress. He's not tripoding or having retractions. His chest is proportional to his body size. He's not barrel chested. And now I'm going to look at his skin integrity. So there's no port or pacemaker present. His skin is clean, dry, and intact, and his color is appropriate for ethnicity. Now I'm going to palpate. No lumps or bumps. Is that tender?
No.
Okay, so now I'm going to listen to your heart sounds, and then after that I will listen to the lung sounds. So I am now listening to the aortic at the second intercostal space. Okay. Now the pulmonic second intercostal space on the left side and the aortic is on the right side. Now first point, third intercostal space, left side. And now tricuspid, fourth intercostal space, left side. And now mitral, fifth intercostal space, left side. Now I'm listening to a point of maximum impulse for 60 seconds. regular rate and rhythm, S1 and S2 present. So now I'm going to listen to your lung sounds. If you can sit up for me, please. Just breathe normally. Sounds were clear anteriorly. Breathe in. Breathe in. Lung sounds were clear bilaterally. So do you smoke at all?
Oh, yeah.
That's really good that you're not smoking. Smoking can cause COPD and other health problems, so keep up not smoking.
Okay.
Okay, so now I am going to have you lay back down. I'm going to inspect your abdomen now. So, I'm inspecting your abdomen. Okay, skin is clean, dry, and intact. There are no deformities present, and the color is appropriate for his ethnicity. So, have you had any problems with going to the bathroom?
No.
Have you had any chest pain or shortness of breath? Okay, so I'm going to start in your right lower quadrant. I'm going to listen for bowel sounds. So we had active bowel sounds in all four quadrants. If they were absent, I'll listen. If they were absent or hypoactive, I will listen for up to 5 minutes in each quadrant. Now I'm going to palpate. Let me know if you feel any tenderness.
Yes.
Were you tender?
Yeah.
Yeah, no tenderness and no rigidity in his abdomen. I'm going to palpate your bladder. Okay, were you tender?
Yeah.
His bladder was not distended. And yeah. So have you had any difficulty with passing stool?
No.
Okay, what do your bowel movements look like?
Around the solid.
Okay, so now I'm gonna do my GU assessment. If you're uncomfortable, please let me know.
Right.
So do you have a rash or any burning while you pee?
No.
Do you have any concerns in your perineal area?
No.
Okay. I'm now going to perform my perineal assessment. I'm performing the perineal assessment. I'm looking for parasites, skin breakdown, and foul odors. Okay, so I am looking at his skin. His skin is clean, dry, and intact. There's no rash, no foul odors, or parasites present, and the color is appropriate for his ethnicity. Now I'm gonna turn you. 1, 2, 3. Okay. I'm looking at his coccyx, his perineal area, his buttocks, and his lower back. His skin is clean, dry, and intact with no foul odors or parasites. The skin color is appropriate for his ethnicity. There is no rash present and no infestations or parasites. There are no deformities as well on his perineum, his coccyx, his buttocks, or his lower back. Okay, now I'm going to assess your lower extremities. So first I'm going to inspect. So if you can pull up your sweatpants for me, please. Thank you so much. So his skin is clean, dry, and intact. There are no deformities present on both of his legs. Okay. Clean, dry, and intact. No deformities. Skin color is appropriate for his ethnicity. Okay. Skin color is appropriate for ethnicity. Clean, dry, and intact. No deformities. Okay. Now I'm going to assess for swelling. There's no swelling or pitting edema. And now I am going to do circulation. So I'm going to do dorsalis pedis pulses equal and 2+. Then posterior tibial pulses are equal and 2+. I'm going to do your capillary refill. I'm assessing his toes. His toes are well groomed and maintained. They're not clubbed. Toes are well groomed and maintained and not clubbed. Now I'm going to assess capillary refill. Capillary refill was less than 2 seconds on all 5 of his toes on his left hand side. So capillary refill was less than 2 seconds on all 5 toes on his right side. So I'm going to assess your sensory.
Mhm.
So you can close your eyes and I'll touch one of your toes and tell me which one.
Big toes.
Okay, can you pull up forward, pull down, so he has equal strength. And now can you wiggle your toes? Okay, now can you ride your feet like a bicycle? There we go. So he has full range of motion for both fine and gross motor skills. His skin temperature is warm. And now I'm going to palpate. Let me know if you're tender. Are you tender?
No.
Okay. Non-tender, no edema, no deformities or masses palpated. Let me know if you're tender. Okay. Are you tender?
No.
Okay. Non-tender, no edema or deformities present or masses on both legs. So now I'm going to have you put on your shoes and you can go ahead and walk. I'm going to assess your walking. So do you have like any leg pain?
No.
Okay. Do you use any assistive devices while you walk? Okay. Let me know if you have any pain. So his gait is steady, he's not limping, and he is independent. Okay. Do you have any concerns for me at all?
No.
Okay. Well, let me know if that changes. Here is your colli.
Thank you.
Your bed is in the lowest position. I'm putting your bed locks on. Here are your personal items within reach. Okay. I'm going to sanitize my hands before I leave. Okay, and now I am going to document everything in my skills complete.